open access model is a way to bridge a very interesting gap. Is one of the ways that we can begin to address structural determinants of health, in our communities. Open access model, for example, presents a forum where people can come in and they're welcome, without judgment and without wait times. We have research now around how they perceive themselves in the society. How do they perceive themselves on a spectrum? Where are they on a social spectrum and an economic spectrum? How do they perceive themselves? What we find is people who sort of perceive themselves on the lower end of the spectrum, they just have a much more difficult way to navigate the system.
We really shifted, I think, our thinking about who the person that we call patient is, and tried to reduce program level demands on that person. The more demands you put on someone, come this time every day for this many days, bring these pieces of paper, show up with this card, don't be late. The more demands you put on a person, the less likely they are to be able to navigate those demands. So we just systematically have looked at our treatment programs and tried to reduce demands, to make it easy for people to enter treatment and easy for them to be encouraged to stay in care.
There's a mandatory counseling requirement, which is a national regulation for people to be enrolled in methadone treatment. They have to meet a certain number of counseling hours per month. This can be restrictive in general if people have to make like a certain appointment at a certain time, and that's challenging. At APT, we've liberalized the requirement, but it still meets the federal guidelines by having groups that people can just drop into whenever is convenient to them and whatever topic is interesting to them.
Stigma is one thing we have to think about, particularly around methadone. And it really talks about the history of methadone, how we started using methadone for opioid use disorders, and how it's been stigmatized and racialized from the get-go. I think as healthcare professionals, we have to think about how to, in fact, destigmatize methadone and put it in a position where it is a legitimate medication for opioid use disorder. Understanding the stigma around methadone would also help us engage our patients in a more humane way. And on the policy level, I think there still has to be a lot of changes around methadone. We just have to keep advocating for this model to really be the model of substance use disorders and addiction.